Hello, everyone. My name is Shannon Giansapulu, and I am the program coordinator at the Faculty of Medicine's, the U of T Faculty of Medicine's Office of Inclusion and Diversity. Welcome to the Diversity Dialogue, Resisting Anti-East Asian Racism During the COVID-19 Pandemic and Beyond. There's been a really concerning surge in acts of anti-East Asian racism in Canada in response to the COVID-19 pandemic, which range from microaggressions to acts of physical violence or assault. And this has been occurring within healthcare settings, on campuses, and beyond. And so I'm just going to share my screen. So this event aims to unpack these acts and name them as racism, contextualize the violence occurring as a continuation of the historical acts of anti-East Asian racism in Canada, and provide some tools and examples of resistance, allyship, and coalition building. So as this is a one webinar, we can't provide all of the solutions today, but however, we hope to provide a few tools for your toolbox, and with that is up to really all of us individually and collectively to continue learning and unlearning in order to address racism. And so a few quick event logistics. Today we'll have a 45-minute panel discussion followed by a question and answer with the audience. The chat is actually disabled, so if you're looking for it, you won't find it, but you can actually post your questions at any time in the Q&A box, and we'll get them to them at the end of the panel questions. We have many people joining today. We had almost 300 people register, so we won't be able to get to everyone's questions, but we hope that the conversation will continue after the event. Captions are being provided for this webinar, and the webinar is being recorded, so we will share it on our website and on our Twitter account a few days afterwards. Once the webinar is over, you should see a post-webinar survey pop up on your browser, and just in case if you don't see it, I will also email out that survey. So before we begin, I will read a land acknowledgement. We would like to acknowledge the sacred land on which the University of Toronto operates. It has been a site of human activity for thousands of years. This land is the territory of the Huron-Wendat and Petun First Nations, the Seneca, and most recently the Mississaugas of the Credit. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and Confederacy of the Ojibwe and Allied Nations to peaceably share and care for the resources around the Great Lakes. Today, the meeting place of Toronto is still home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work in the community on this territory. So land acknowledgement challenges ideologies furthered by the doctrine of discovery by naming that this land was not empty when settlers first arrived on Turtle Island. But it should also be taken as a reminder to those of us who are not Indigenous to this land to ask ourselves and continue to ask ourselves and work towards reconciliation and decolonization. So asking ourselves those difficult questions. And for example, due to colonialism, COVID-19 poses disproportionate risk to Indigenous communities. And as a specific example, I have been paying close attention to the construction of the Coastal GasLink pipeline, which construction of it continues through transient work camps, despite social distancing requirements. And Wet'suwet'en land defenders have pointed out how this is posing really great risk to their communities. So I take the land acknowledgement, and we can take that today as a reminder to make connections in our anti-racism work to colonialism as well. And so I'm going to read the bios of our amazing moderator and panelists today. Dr. ARNO KUMAGAI is our moderator, and he's a full professor at the University of Toronto and vice chair education in the Department of Medicine. He also holds the FM Hill Chair in Humanism Education from Women's College Hospital and the University of Toronto. Dr. Kumagai received his BA in comparative literature from UC Berkeley and his MD from UCLA School of Medicine. He completed a residency in internal medicine and an endocrine fellowship and postdoc at UCLA. Dr. Kumagai came to U of T from U of Michigan Medical School, where he was on the faculty since 1996. An endocrinologist with expertise in the intensive management of type 1 diabetes, mellitus. Dr. Kumagai is an internationally recognized educational scholar. After a career in bench research, Dr. Kumagai remarkably shifted his research interest from looking into molecular mechanisms of diabetic complications to medical education. ARNO is married to another endocrinologist, Ellen DeMarchi, and they have a somewhat rambunctious son, Apollo. Dr. Kenneth Fung is a staff psychiatrist and clinical director of the Asian Initiative and Mental Health Program at the Toronto Western Hospital University Health Network. He's also associate professor with the Department of Psychiatry, University of Toronto. He completed a 2-year fellowship in cultural psychiatry at the University of Toronto, and his master's thesis was on alexithymia among Chinese Canadians. His primary research, teaching, and clinical interests include both cultural psychiatry and psychotherapy. He is the block coordinator of the Cultural Psychiatry Core Seminars for Psychiatry Residents. He is a seminar co-lead and psychotherapy supervisor in CBT at the UHN and teaches and conducts research in acceptance and commitment therapy. He's involved with community-based research projects related to HIV, mental health stigma, and immigrant and refugee mental health. He is a psychiatric consultant to the Hong Kong Mental Health Association and is involved in various mental health promotion and education projects, as well as cultural competence training in the community. He offers consultations at Mong Siang Scarborough Long-Term Center Care. Ms. Avi Go is the clinic director of the Chinese and Southeast Asian Legal Clinic and a founding steering committee member of Color of Poverty, Color of Change. Since her call to the bar in 1991, she has worked exclusively in the legal clinic system, serving legal needs of low-income individuals and families. Immigration, human rights, and employment law are some of the main areas of law that she practices in. And between 2001 and 2019, Avi served as a bencher of the Law Society of Ontario. She also served on the LSO's Access to Justice Committee, the Equity and Aboriginal Issues Committee, and the Health and the Human Rights Monitoring Group. Apart from her legal practice, Avi spends much time doing community organizing and advocacy work. Avi has received numerous awards, including the Ocasio Lifetime Achievement Award, Senate of Canada 150 Medal, SOAR Medal, Order of Ontario, the Federation of Canadian Lawyers, Lawyer of Distinction Award, City of Toronto's William P. Hubbard Award for Race Relations, and President of the Women's Law Association of Ontario. Dr. Jeffrey ANDRION was born and raised in the Philippines. Jeffrey is the first-generation Filipino-Canadian working as a faculty member of the Ontario Internationally Educated Physical Therapy Bridging Program at the Department of Physical Therapy, U of T. He's also a physiotherapist at the Sunnybrook Health Sciences Center and is co-chair of the Philippine Working Group on the International Center for Disability and Rehabilitation. Currently working on his PhD dissertation on the experiences of transnational physiotherapists in Ontario. His research interests are in areas of professionalism and identity, integration and labor studies of the immigrant population in Canada, with a special interest on healthcare professionals. And Dr. Stephen Cho, who I've had the pleasure of working with on the lead committee, is a third-year medical student at the University of Toronto. Prior to studying medicine, he obtained his Bachelor of Health Sciences degree at McMaster University. Stephen has participated in many equity-focused works at the Faculty of Medicine, including his recent role as the chair of the Learner Equity and Action Discussion Lead Committee. His main interests are political advocacy, medical education, and health equity, and he's definitely one to watch. So, you know, I'm just gonna stop sharing my screen. The collective knowledge we have on our panel today is really astounding. And, you know, I even had to shorten all of your bios. There's even more amazing accomplishments that you all have. So I'm so grateful to get to learn from you today. And thank you so much for being here. And with that, I will give it away to Dr. ARNO KUMAGAI. And you're
thanks, Shannon. Just had to unmute. So thank you, Shannon. I really appreciate this. As Shannon mentioned, I'm ARNO KUMAGAI. I'm Vice Chair of Education for the Department of Medicine, and I have the real distinct privilege of moderating today's dialogue, which is on essentially, or simply put, anti-Asian racism in the time of COVID. As I think all of us are aware, there's been increasing attention paid to this matter, including recent news stories on racism. There was a particularly interesting one about racism against Asian American healthcare workers that was in the New York Post, I'm sorry, the Washington Post on May 19th. I've sent a copy to Shannon and she can distribute it to the group if you're interested. Also, especially sensitive issue being an American, President Trump's racist confrontation with the Chinese American reporter, where he said, "Why don't you go ask China?" at a recent news conference, kind of highlights how the COVID crisis and Asians in general and those of Asian heritage have really been indelibly linked. So the panel today will be speaking on how COVID has impacted anti-Asian racism here in Canada, their thoughts, their insights, and perhaps what we can do as communities of color and as communities in support of people of color and those who are marginalized, how we can support these efforts in combating this really malignant force. So I'd first like to go to the panel. Shannon spent a great deal of time introducing everyone, so you can see it's really a group of superstars. What I'd like to do is I'll ask a question. We have 4 questions to start. Have the panelists each answer those questions, and then we'll actually do it in reverse order. So we'll start with one question, and the second question we'll have the last person who answered the question answer the first one, and we'll go through the 4 that way. So why don't we go ahead and begin. With the spread of COVID-19, anti-East Asian racism, xenophobia, and xenophobia have been on the rise in Canada. The Canadian Union of Public Employees reported that there was, in a recent survey of Manitoba healthcare workers, 1 in 5 who self-identified as being of Asian heritage experienced racism in the workplace in March. Also, according to a recent poll by Corbett published on CTV, 14% of respondents in Vancouver, Toronto, and Montreal believe or aren't sure whether all Chinese or Asians are infected with coronavirus. And 1 out of 5 people in the same cities, quote, do not think it's safe to sit next to an Asian or Chinese person on a bus if they have no mask. Also, 1 in 8 respondents were aware of racist incidents within their neighborhood since the COVID-19 pandemic began. So the question to the panel is, have you seen anti-East Asian racism play out, and how in healthcare services, healthcare education, and beyond in Canada? So first starting with Kenneth Fung. Kenneth?
Sure, thank you. Thank you for inviting me to this event. And I think it's an important dialogue we're having. So certainly as an East Asian Canadian, I have myself and my family and friends and my staff, as well as my patients, have reported incidences of racism. And certainly it focuses in COVID-19 along 2 themes. One is that as Chinese or Asian Canadians who are seen as vectors of infection, as Dr. KUMAGAI just alluded to in the prelude, that we are somehow more dangerous. My clinic, for example, serves the Chinese Canadian at the hospital, and early on there was a lot of talk, even within the hospital, whether just because it's a Chinese clinic, it means it's a mental health clinic, not a lung clinic, but it was deemed as like dangerous grounds, or there should be higher alert. There should be special procedures around my clinic just because it serves Asians for mental health issues. So that's even early on, before there was any thought of community spread. Just by virtue of ethnicity, we were seen as vectors of infection, almost like the entire clinic, staff and patients. And certainly there was a lot of conspiracy theories that is spread around the origin, the guilt, the blaming, the shame about how Asians and Chinese Canadians, or China in particular, have been spreading the virus, and this is leads to a lot of anger and resentment. Postings on social media that people get. I think all this leads to a lot of the Canadianization, I suppose, of the identities of the Asian Canadians. So that hyphenated identity, it's almost suddenly gone. So instead of Chinese Canadian, it's just, oh, look at those Chinese people. So being part of belonging to Canada, it's almost been undone. That leads to, in a lot of people I talk to, from friends, who says that I've born here, raised here, never experienced this in my life, and now it's blatant in my face. Like healthcare workers, to my patients who have internalized a lot of fear and anxiety. And we know in research that leads to a lower sense of belonging, as well as worse mental health outcomes. And this is actually with Chinese Canadians in Ontario, using Ontario data, both. And it leads to lack of mental health promotion in the language, as well as inadequate health services. I have patients who are crying at night because they have nightmares of being blamed as a Chinese Canadian citizen. I have patients who are afraid to go shopping, and also receives hostility because they're wearing a mask in public places. I know I can go on, but I can see that there's a time signal to go on, so I would just pass it on to the next.
So I thank you for your remarks, Kenneth. I just wanted to remind the panelists, we each have about 2.5 minutes apiece, so if you can kind of time yourselves. I don't have a hook or a gong, so I'm not going to be able to use those, but if you see me wildly waving, that means the time is just done. So Avi Go is next. So if you would mind responding, how have you seen anti-East Asian racism play out in healthcare services, healthcare education, and beyond in Canada?
Sure. Thanks. Thank you for inviting me. I just want to start by saying that, in fact, the poll that you're referring to about the 14% who thinks all Chinese and all Asians have the virus, that poll was conducted by a group called the Chinese Canadian National Council for Social Justice. We are a partner with that organization to do a project to combat anti-Asian racism during COVID-19. And in fact, the poll came out of that project. So, interesting anecdote, when we put the question to the pollster, like the company that is doing the poll, and we wanted to include that question, they were saying like, whoa, maybe we shouldn't do that. That's so extreme. So, but in fact, the result is the extreme, like, sort of like the fact that there are so many people who actually think that way is, is shocking, or maybe we shouldn't be shocked, right? We're talking about racism. After all, racism has existed in Canada for a long, long time. And I think apart from the polls, we have also heard many incidents. I think Kenneth mentioned that. But a number of groups started to collect stories, like online tool reporting. There's a group in Vancouver, a group in Toronto. They're launching it in Thursday. But even before they have actually officially launched the online reporting tool, they have already received, close to 80 people who kind of share their stories. The group in Vancouver has collected over 100 so far. And it's just, it's not healthcare workers, but just people going about their daily life, right? Going shopping, waiting in line for the public transit, and they are being spat at, punched, stabbed, yelled at, cursed, everything, like, under the sun, because they are Asian or they look Asian. And, they're being told, including Indigenous people who look Asian, are being told to go back to their own country. So it's really disheartening. But I think, to me, what is more disheartening is the completely lack of adequate response from our official. I know Trudeau has a number of times during the press, the daily announcement mentioned, don't be racist. But other than that, like, the government actually hasn't really done much to address this kind of issue. And I think the silence on the part of government almost give license for people to continue their racist behaviors. So I hope that we will have more chance to talk about that, but I'll stop here for now.
Thank you, Avi, really appreciate it. I guess next, Stephen, if you wouldn't mind responding.
Yeah, sure. First of all, thank you so much for having me. Very honored to be here with accomplished guests. Now, with respect to the question, yeah, I'm super upset about the number of stories I hear of anti-East Asian racism in the news. You know, stories like people getting physically hurt and receiving verbal abuse. And I've had an experience not too long ago. I was actually out on a walk or run near Queen Park, and there was a car driving past me with a bunch of guys shouting a bunch of racial slurs and telling me to go back to my country with this disease that I brought. So that was pretty crummy. And there are probably so many of these individual instances of racism in the community that have not reached our awareness, but certainly in the recent days, there has been an increase in the level of hate. Now, in the healthcare services, as a medical learner, I've been pulled out of my clinical clerkship rotation prior to the pandemic getting much worse. So I probably have not too many personal examples to share, but I've had a fairly memorable experience with a patient right before this happened. When I entered the examination room to greet my patient, she kind of had this aura of suspicion and she looked visibly concerned. I had a face mask on at the same time. And she started questioning me, oh, where in Asia did you train? I think she had this assumption that I was, first of all, an international medical student. And she dropped a line somewhere, something like, oh, I hope you didn't train anywhere near Wuhan or affiliated with that kind of place. So I was kind of frozen. I'm accustomed to microaggressions, but I don't think I've ever felt this way in a long time. So that's my personal experience. And on the patient side, I also hear anecdotally from preceptors of Asian descent that people are complaining of the fact that they have to share the same space with other Asian patients who are wearing face masks. So just seeing all these examples, I'm very saddened at all the hatred and bigotry that this COVID-19 has triggered. And I think it's affecting just multiple aspects of our community, but also the healthcare services that we're so accustomed to.
Thank you, Stephen. So just before we go on, I just want to apologize that you had experienced that. That's, you know, as somebody who's deeply involved in education, that's inexcusable. And so I'm sorry, even though everybody's been pulled from the wards, that you had to experience that. Next, Jeffrey, would you like to make some remarks about the question?
Yes, thank you, Arno.
Sure.
Really, in the next 10 seconds or so, I would like to invite all of you to think of one word that you associate COVID-19 with, and try changing one letter of the word so that it becomes an entirely different word. For example, we associate COVID with mask, and if we change that word, it becomes task, as indeed it has become our task to wear a mask right now. Today, I would like to propose the word fear, so that if we change one letter, it becomes here. By using this framework of what I call the power of one as a point of departure, it demonstrates how one letter, one action, or even one virus has instilled fear in us, and in the process, caused us to refuse to hear the disenfranchised groups, the Asians especially in this case. We also know that we don't hear people who have been affected the most: Black people, the seniors, the immigrant healthcare workers, persons with disabilities, and the homeless. We are currently seeing in Alberta right now how immigrant Filipinos, workers in a meat processing plant, for example, have been blamed as the virus carriers. We are also seeing how Filipino nurses, support workers, and other healthcare practitioners have died from COVID-19. I think beyond its biological effects to the medicalized and the racialized bodies of immigrants, we are also seeing now how COVID-19 has revealed the social nature of the disease. For example, some of those Filipino immigrants working in factories may have just received their permanent resident status, and they have been working for years as live-in caregivers. Now, keeping in mind that these people may be working in areas wherein they don't have the full benefits of a workplace safety. And so what happens is that they go to work without any personal protective equipment in place. I think it is also very important for me to mention that the majority of Filipino healthcare workers are employed in areas that are not necessarily popular among employment places, for local graduates or even for local practitioners, and this include nursing homes, which we know have been greatly affected by COVID in Ontario. In other words, the fear instilled by the virus on immigrant and racialized bodies also revealed how privileged individuals in our society may have failed to hear our stories. Thanks, Arno.
I think you're on mute, Arno.
You're right. Thanks, Kenneth. So thank you, Jeffrey. Those were incredible insights. And I think it's important that we're talking about broadening this. So it's not just anti-Chinese and it's not just anti-East Asian, but it's actually impacting Asians really across the board. But more importantly, and I think we'll talk about this in summary, is how does this impact the way we see other marginalized groups, as you so eloquently expressed? The fact that Blacks, for instance, have a much higher mortality rate from COVID than any other group, particularly in the United States. Going on to the next question, understanding issues such as racism in this context requires a historical context. We need to look at racism in terms of history and histories of oppression. And after all, a Confederate flag isn't just a flag, as we have learned so painfully in the United States. There's a long history of anti-East Asian racism in Canada, as Avi and others have pointed out. However, perpetration of the false model minority stereotype tends to work to obscure acts of racism faced by East Asian people. So the question we have is, how can current acts of racism be contextualized within this long-standing history of anti-East Asian racism? So why don't we begin in reverse order with Jeffrey, please. Jeffrey?
Thank you, Arno. Yes,
Yeah.
thank you, Arno. Yes.
Sure.
I think it is important for me to mention that in 1918, when the flu pandemic hit the Philippines, it was widely believed by the Americans that their colonized people, the white man's burden, already carried the flu virus long before that virus came from Europe or arrived from Europe. In short, the Americans strongly believed that the virus was autochthonous. It was endemic to the bodies of the Indios, or how we were called as uneducated by the Spanish for 300 years. And that virus from Europe mutated with the local version. The idea that the Filipino body is a carrier of a deadly virus has a long-standing history, and it is very sad that the same story is starting to emerge again, but this time in Canada. Consequently, the idea of an autochthonous virus living in a racialized body has now transcended borders and boundaries. That while Filipinos are no longer the colonized people, we have always been blamed as disease carriers. We have heard stories in Alberta about how Filipinos were shunned away from stores or being assaulted verbally in other parts of the world and told to go back home. So in essence, our globalized bodies as factory workers, nannies, live-in caregivers, immigrants, or even temporary workers have been the subject to the new forms of oppression that is being brought to the surface by COVID-19. And so the long history of anti-Asian sentiments in Canada only suggests that our Filipino bodies have already been stigmatized as deadly and unwelcome. Considering that a substantial number of Filipino bodies in Canada work in low-paying jobs, my fear is that owning this stigmatized body can have its implications to how they will be treated by their employers, who may use this as an excuse to further ghetto Filipinos to work unsafely and consequently treated maliciously. And to go back to the framework that I earlier suggested, instilling fear among the public about how dangerous the Filipino body is prevents the diaspora from being heard or even consulted and even recognized. And I think this invisibility is scary, if not deadly. Thanks, Arno.
Thank you. Really appreciate it, Jeffrey. Stephen, your thoughts?
Yeah, this is an excellent question. And I'm really should just say I'm really not a fan of this model minority stereotype. It basically assumes that Asians are a monolith population, which is completely ignoring its diversity and communities, and effectively depicts a picture of those smart, math-loving kids with families grounded in education, rich and affluent. Of course, these are based on a selected few examples, but I think this is one of the cardinal reasons why anti-Asian racism is not taken too seriously. You tell others how you're minoritized and you share your experience and the pain of racism and discrimination, and you can hear people say that, well, your group is so much better than the other groups. You have it, I don't know what you guys are complaining about. And people tend to kind of brush it off, thinking that we as Asians are somewhat immune to this whole process, the virulence of racism. And as a result, there's this wide conception that we don't face the same barriers as other racial groups, and as well that our experience is not worth talking about. And I think for the people experiencing racism, this is absolutely discouraging. It discourages any sort of actionable or help-seeking behaviors, and is forcing people to just remain silent because they know that their voices will not be appreciated. So I think this is the reason why, or this is what is causing people to perceive the whole situation, not as a historicized act of racism, but rather as just individual incidents, like you said. And I think we need to get rid of this model minority mentality. And I think once we start doing that, I think people can then just take a pause and better recognize that, hey, this isn't just a one-time individual experience. Hey, this isn't just Stephen's experience when he went out for a run, but it's rather a familiar pattern that we've seen throughout history, this pervasive anti-East Asian racism that has unfortunately been unrecognized and been silent.
That's a great point, Stephen. I think Jean-Paul Sartre said about anti-Semitism that what anti-Semitism and what racism is turning people who are constantly inventing themselves, becoming new people, into things with immutable characteristics. So it doesn't really matter in some ways whether those stereotypes tend to be positive or negative. They still can have a really malignant impact. So I think that the idea of being treated as a thing, even though it may be a thing with supposedly favorable characteristics, is still bad. It denies uniqueness, it denies individuality. Avi, thoughts?
Sure. Actually, I never even get this model minority thing. Like, I don't get it at all. I don't understand it. So I think part of it is because, I came to Canada as an immigrant. So, I didn't grow up in Canada. So maybe I don't get that. But also because I spent sort of a long time, like maybe about 20 years, working on the redress for the Chinese Head Tax and Exclusion Act. It's like brief history lesson. Between 1895 and 1923, China has to pay a head tax to come to Canada. And then from 1923 to 1947, there was an Exclusion Act. No Chinese can come to Canada, period. So it took the community about 20 years to get redress. Stephen Harper apologized in the parliament and get some funding. Our clinic actually received a funding to create a website called Road to Justice, which documents how the law in Canada for over 80 years was used to discriminate against Chinese and other Asians as well. So, I mean, with this dark history, so where did this model minority come from? I don't understand. So, and I don't see how it works even today. How does it really work? Because I don't see, a representation of East Asians, Chinese Canadian in particular, and in any major Canadian institutions. We're not reflected on the judiciary, we're not reflected in the parliament or the Senate. So if we are indeed model minorities, there should be more of us there, but we're not. And I don't see how it works for my clients who are just as marginalized as other people of color. Many of them don't even make minimum wage. They're just exploited because of the race and sometimes their immigration status. So honestly, I have never seen the model minority at work in my life in Canada. But other than that, I also think that there are so many counter examples, right? Every time, it doesn't matter how accomplished you are. Just take Dr. Theresa Tam. like he's the chief public health of Canada. And as soon as something happened, it's like Derek Stone, the MP, would say, well, are you loyal to Canada or to China, right? It's like her race came into question right away. And so it doesn't matter whether you're Canadian born or, you know, immigrant or whatnot. People see you for your race first before anything else. And what Derek Song said to me is the same as what Sir John A. Macdonald said about Chinese when he decided to disenfranchise them. Chinese, well, he called them Chinamen. Chinamen are strangers in a strange land. They're sojourners. Therefore, they do not deserve the right to vote. That's the same kind of mentality we're seeing today, whether it's from Brian Adams or from Derek Stone or from anyone else who shared their views. So I never see model minority at work.
Avi, I think to clarify, that term came up originally back in the 1970s and 80s from the United States, where the idea was that Asian Americans in particular were disproportionately represented. And this is really East Asian, so Chinese and Japanese were disproportionately represented in certain fields. But the trouble with that is that it tended then to further marginalize groups like Filipinos, South Asians, who weren't part of that. And you're right, I think it has had this really negative effect. But there is something to this, and I think either way, I think it works. But there are a lot of exceptions, but it still works very, very negatively. Kenneth, your thoughts?
Yeah, thank you. I agree with all the previous presenters on this. And as Arno was saying, it is in the literature about the model minority, Asians being model minority in North America. It's a successful minority group. But even more often now, it's actually written as the myth of model minority, rather than just model minority, as also a lot of the speakers, the panelists, colleagues have pointed out. I think it's a shame in a way some of the Asian cultural values, which are good stuff like education, working hard, a long-term orientation, the importance of family, importance of harmony and not making yourself stand out too much. Some of these are traditional cultural values which have certain strengths, are kind of stereotyped into something that's called positive, but in reality in a very negative way, I think, as people have pointed out. And it does a number of things. Well, first of all, I think that the myth of the model minority means there are many, many, many people who don't fit that narrative, are neglected or just kind of written off. And so that is obviously, as I think Stephen has also pointed out, we're just seeing one group of people and say, okay, this is the whole group, which is completely incorrect. And then there's also, in addition to so-called these positive stereotypes, there are actually a number of negative stereotypes that maybe is less talked about, from Chinamen to being weak to being terrible drivers. Like a couple of months ago, a taxi driver cut me off and had a full 2 minutes of stereotypic racial slurs about Asians. So this is not to be forgotten as we often talk about the model minority thing. And the model minority thing is sometimes brought up, and because it just seems like it's easier to promote, as you talked about, it's easier than to not face the inequities of linguistic and cultural needs of the populations. And that's very clear even in healthcare, even in mental health care, that there's a perception that this is model minority group, their needs are less, when all the study shows that the needs are more or worse, or yes, they were good at one point as immigrants, but then they're made to feel worse, like the so-called healthy immigrant effect. That is, Asian immigrants come healthy because they've been selected to be healthier than the general population, but being in Canada slowly poison you so that you catch down to the general population, if not oftentimes below the general population. There's the outright racist attitudes and actually laws and incidents historically throughout Canada's history that AV has pointed out, and her group has done a lot, from hat tax to all kinds of legislations, to covert racism among the Asian communities that's been felt, and also with research studies showing that covert racism or the subtle racism hurts just as much and sometimes even more, because you feel like, am I just being oversensitive? And in fact, the myth of model minorities means, yes, you are just being overly sensitive. Look at the other races have it worse. So whatever you perceive is not even legitimate. So it actually puts people in a psychologically more vulnerable space when you can do racist acts against them and you're just being too sensitive. This leads to the whitewashing of everything in Hollywood movies and representations to politics where you're not supposed to stand out, to the phenomena of bamboo ceiling. This goes along with the myth of model minority, is that you are allowed to succeed somewhat, but not too much. As soon as you are outspoken a little bit, you are breaking that myth of model minority mode, that you're supposed to be quiet and industrious workers who don't complain, but you don't get to be the top, which is what Avi has also noticed, that you never see anybody in real power because as Asians, the myth of model minorities also has a certain narrative that they don't complain much, that they don't have too much problems, and they need to be hardworking, succeed, but just not too much.
One of the things that I wanted to quickly point out, which I think you're alluding to, Kenneth, is this idea of gaslighting. I think people are familiar with this term, particularly in the area of Trump. But it's this notion that one may be terribly insulted or offended, and yet somehow they are made to be convinced that the problem is with them, that they're crazy, and that it's not the malevolence and the pathology is not on the other person's part, but the pathology is on their own. Avi, do you have some comments in terms of some of the things that we've been talking about?
Yeah, sure. Yeah, I think, and I totally agree with everything that has been said. And I see that particularly in my area of work as well. You know, sort of, I don't want to go too far afield, like, you know, sort of, but certainly, like, you know, if you see, you know, I mentioned the judiciary, or even if you look at law firms, like, you know, you can certainly see Asians working on Bay Street, but very few partners, for example, right?
Let me, if I may, let me refocus this a little bit. I'm
yeah, sure.
didn't mean to interrupt, but in terms of looking at inequities within society, for instance, anti-Black racism and anti-indigeneity have been really embedded in many of the individual and systemic responses to COVID. So how do you see, you know, particularly in your area, in your legal domains, how do you see this kind of allyship building among different marginalized groups? Could you comment on that?
Sure, yeah. We've been working very closely with different communities. You know, in 2007, we formed a group called the Color Poverty, Color Change, which is to talk about address the growing racial inequalities in Canada. We started off focusing on the racialization of poverty, but sort of like, you know, we have expanded towards, you know, to other issues like health inequities, sort of employment, housing, food security, and so on and so forth. And the whole idea is to try to support all of the different communities while recognizing that each community experiences racism. But there are common ways to address them, right? So I think we're focusing more on the policy level and how do we come up with policy solutions that will address systemic structural racism at its core. So for instance, one thing that we've been pushing since day one is the collection of disaggregated race-based data, which I think during this time of pandemic, it's become clear that Canada is not doing its job in collecting race-based data. You mentioned that the United States shows Blacks are, you know, have overly represented among the people who died from the COVID. Canada doesn't even collect data, so we can't even know who are being more affected. We don't have data to show, for instance, I'm sure among the PSWs and healthcare workers, as you know, Jeffrey mentioned, there'll be a very large number of racialized women in general and Filipino Canadian in particular, but none of that data exists. So I think in terms of allyship, we should think about what is it that we can work together and focusing on solutions, policy solutions, and support each other.
Wonderful, thank you, Avi. Incredibly important points. Stephen, in the medical school, what kind of efforts do you see where people are actually reaching across groups and looking at mobilizing, for instance, students of color or students from marginalized communities in response to some of these issues, particularly in this case, COVID? Anything that you've seen on campus, virtually at
Sorry,
least?
you were kind of cutting off from my end. Were you saying that some responses to COVID?
So the response to whether or not you've seen coalition building among different groups. So for instance, medical students of Black heritage, African heritage, or indigenous students or from indigenous communities. Have you seen any kind of coalition building with, say, East Asians or Asian groups on campus or in the medical school?
Right.
Particularly
I think on an individual basis, there are definitely allies who are supportive of the cause and they're helping to raise awareness. But my kind of personal experience is that I think we still have to work towards building that coalition. And I think the coalition or working together in a collaborative sense is really important when it comes to anti-racism movements, because I think multiple fragmented shouting and waving of banners is significantly ineffective than a unified voice. And any work that is done in an isolated manner in silos will be kind of brushed off by the institution or by groups that have more established voice and status. So from that practical point of view, I think we should try harder to really come together, kind of regardless of the advocacy group or the groups that we're trying to represent, that we should come together as a group. I think just to build on that, a second reason why we should work together is because effectively we're trying to achieve the same thing. And this may sound like a common sense, equity for all, no discrimination based on your identity. The common enemy that we have, the institutional barriers, the systemic inequities, you name it, that perpetuate racism. And like I said, although it may sound like a duh thing, like, yeah, you should work together for the common goal, you don't really see this happen a lot. And I think I see more of the independent works that are happening. But I feel like that can create, unfortunately, some sort of sense of competition where individual groups are trying to like fight for the spotlight or even funding to carry out an initiative. And when you get accustomed to that, I think it's easy for one group to perceive the other minoritized group as less important or their agendas as less urgent. So I feel like as much as it's important to really strongly advocate for the stuff that we believe in and the minoritized group that we belong to, I think by coming together, we can surmount these challenges and really take this further one step.
Great, thank you. Jeffrey, thoughts in terms of coalition building, particularly with regards to marginalized groups and COVID?
Yeah, and so I talked a while ago about the power of one letter to change a word, one act of kindness, one act of allyship. I think that it is only through a collective power of one can voices be heard. Therefore, creating and maintaining allyship within and beyond the disenfranchised groups is necessary. Coalition building and allyship are really critical at this point, but I think it is also important to note that these activities that involve these disenfranchised groups should make sure that the people who have been victims of all this COVID pandemic should be part of that conversation. In other words, there's really nothing about them without them, or in our instance, there's really nothing about us without us. I also think that it is important to start building a pandemic-resistant coalition of individuals who are willing to show what tolerance and understanding is all about. At the same time, we have to remember that the virus does not have any predilection for any race. But what's happening right now is that our response to the virus as a society tends to be selective, and therefore it has become an issue of race. And I think that's not right. And so social justice as the cornerstone of allyship should be called into action so that the oppressors will know the power of one, and hopefully they will become part of the allyship.
Wonderful, wonderfully stated. Thank you. Going on to our last question, and we're going to start with Kenneth first. So after hearing all of these things about how it's impacted, how COVID and underlying and historical racist trends have impacted really the responses and the experiences of Asians in Canada, what concrete actions can folks take to resist anti-East Asian racism, either those experiencing it as East Asian Canadians or East Asians here in Canada, or those who are allies. So Kenneth, could you comment on that?
Sure, thank you. So I think that the dialogue and the platform like today, it's a very good vehicle and good start. I think that with things like racism, as Canadians, we like to also, the other part, see ourselves as, no, we're not racist. That could be somewhere down south of the border, but not Canadians. But that is the proverbial, I think, denial, just based on what we discussed. So I think that having this reflection piece to make the invisible visible, to make the kind of covert, and we identify it, so that just like the title of today's talk, it helps us to resist that psychological narrative of we are a peace-loving, non-racist nation, and there's model minorities, and everyone is happy. And we need to be honest and to identify that there are issues here, that otherwise the minorities will be neglected. So to shed light on it. And so the other is for those who are experiencing it themselves, not to internalize it, because as we discussed, a lot of this can be easily internalized. So yeah, it's kind of our fault. Oh, I'm just oversensitive, or that is not really happening. So to be able to identify people who do experience acts of racism, how big, how small, systemic, and individualized, to identify your own thoughts and emotions, and not to allow it to be, that's just the way it is, and to respond safely. That there are times when you need to speak up, and there are times when it's also important to judge your safety, as you've heard, and to find supportive people, friends and families to talk about, not to let it go, but to allow this to be spoken out aloud. And then, of course, to join and come together in communities and coalitions of action. So I'm involved with a project, Protect, which mounts a community response for the Chinese and Asian communities in terms of both mental health and racism. And of course, CCNC, organizations like that, has a historical track record of championing for rights. I think allies are in a position of power. So at the same time, then they need to also be honest and open to reflect on dialogues, which is uneasy, to be able to support people in their own individual spheres of influence, but also, of course, through systemic changes, that they need to be able to stand up. And I think it's what people have already commented, that if one of us, even if it's a minority group, has the short end of the stick, it actually brings down the whole nation's health. And this has been shown in a lot of even data. So I think that's one thing, which is it's not just those who are disenfranchised suffer, it actually the whole nation, from health indicators to economics, at every level as a whole, we suffer together because we're on the same boat, and people need to realize that.
Great, thank you. And Avi.
Sure, I have three, I guess, suggestions. The first one is that if you do experience racism during this time in particular, or you see something happening, call it out if you can, if you're safe, able to do so safely, but also report it. So I'm going to give a plug to the one of the reporting tool is called covidracism.ca. It's going to be launched tomorrow officially, but the website is already live, so you can go and report the instances that you've seen. The second suggestion I have is to, I guess, like, I think, yes, I agree we could all do whatever we can, but I think ultimately the government needs to be held accountable. They need to be responding to the issue in an adequate way. So, talk to your MP, talk to your MPP to ask them what they are doing with regard to this issue of racism. One thing, of course, we want to focus on is the collection of disaggregated race-based data. And it's not just during this time, but it's for all government policies, because what gets measured gets done. And the fact that we can pretend racism doesn't exist in Canada is because we don't collect race-based data. So I think it also, so we need to call on our government to start to collect race-based data. And the final thing is, just for the pandemic, the federal government has set up an advisory for people with disabilities to talk about how the pandemic affects them. I think they should have one to talk about racism. So I will call on all of you to talk to your MP about this.
Thank you, Avi. Stephen.
Yeah, as a Korean Canadian, I recognize that experiencing racism, it really sucks. Lots of emotion runs through your head. You feel upset, confused, just sad, and utterly disgusted at times. But if you've walked away or have remained silent about what had happened before, I think now is the time to change. And I know it's super hard to talk about this kind of stuff, like talking about or confronting to racism, because it requires a tremendous amount of courage. But I believe that silence alone can't do anything. We have to make a noise. Now, if you feel comfortable and if it's a safe place to do so, then by all means respond in a strong, resolute manner. And if it's not, I think you should also just raise this concern with your supervisors, your seniors, or your colleagues, because effectively no one will know that you've been wounded if they don't know, right? So that's my kind of advice to those people experiencing racism, to speak up boldly when safe to do so, and if not, just make some noise and let others know in some other ways, because you really shouldn't have to suffer alone and internally, like Dr. Fung has mentioned. But at the same time, we have to recognize that we can't just say to these people, just muster up the courage to say something. Because, as everyone else, the allies watch passively from the sideline and spectating, you can't really do that, right? So allies have an equal role in resisting this anti-racism as well. Or promoting anti-racism, sorry. I think they can do that by creating an environment, whether this is in a team, program, department, or institution, where there are clear policies that condemn these harassments and discrimination, and a safe space for the victimized to share their experience so that they don't have to internalize it. And maybe on an individual basis, I think allies should also step up and say something and not really give in to this bystander effect. No one's gonna talk if you don't, and just don't wait for that action to be taken by others. I know it's just as hard as an ally to speak up, but I think it can make a tremendous difference.
Thank you. Jeffrey, you get the last word on the panel.
Okay, so I think organizing meaningful dialogues by the people who are directly affected by discriminatory actions is very important. Again, I was talking about the saying "nothing about us without us," and so it's really important that people who've been victimized by this whole thing should come together and create meaningful dialogues. At the same time, I would also encourage probably universities to create platforms of learning for students, faculty, and staff. I always think that venues like this can become fertile grounds for further discussions and actions. And then we can also always share on social media what we know, and always supported by evidence. One of humanity's greatest teachers is history, and I know that for 100 years, the Filipinos were blamed for the pandemic in 1918. And now we are seeing the same thing emerging again. And so I think it's important for people to be reminded about how particular races have been treated historically. And if you happen to be a teacher, I would also encourage us all to creatively teach how biases or assumptions continue to hurt disenfranchised groups, including the Asian population, and what these all mean to them as students. And then finally, as you go about in your daily activities today or in your next few days, think about the power of one. That one letter that will change a word, that one act of kindness, and that one act to acknowledge that somehow during this pandemic, some of us are still privileged and free from harassment and discrimination simply because we don't look like Asians, or we enjoy a safe working environment because we don't have to work in factories or nursing homes where there's no PPE, or because we are just happy to speak up and free to say whatever we need to say simply because we enjoy the full benefits of citizenship. Unlike those, some of us, especially Filipinos, who have to painfully endure in silence because they're too afraid to speak simply because they are not residents, or simply because they're in the country only as temporary workers. So it is really my hope that we will start turning our fear into a hear, to hear the cry for social justice of the many Asians, including the Filipino diaspora, who have been greatly disadvantaged by this whole pandemic.
Thank you, Jeffrey. These the comments that all of you have made have several things in common. This idea that regardless of what group in terms of East Asians or South Asians we may belong to, we're oftentimes grouped together and labeled and looked at as things. So this idea of losing one's identity, losing one's uniqueness, either as a Canadian or as an American, plays a role. And I speak from a personal point of view as being the son of a mother who spent a good portion of World War II in an internment camp for Japanese Americans. So we know that this happens. But we also know, as Stephen has said, the power of one, taking one step forward, making one individual effort, and realizing that these are systemic problems that, as Avi has pointed out, required systemic solutions. So I think a lot of these things are important. A lot of them are engaged in education, and that's why I'm so delighted, Stephen, that you're going into medicine, because this is exactly the type of approach we need among physicians. And you can look at somebody like Kenneth Fung as a role model in this regard. But I think that these are all really important issues. But the final takeaway thing for me, what I've learned personally, is that it's not just about Asians, and it's not just about East Asians, but these are processes that actually victimize people in many different walks of life, in terms of gender, race, ethnicity, national origin, language, sexual orientation, gender identity, all of these different issues, we tend to be looked at as things, and that's where we need to have a much broader view. At this point, I'm going to turn it over to Shannon for the question and answer period, and we'll leave it open to the faculty. But again, thank you very much for all of your attention to the audience, and again for the panel for your wisdom and many insights. Thank you.
Thank you so much, everyone, for all of those really thoughtful comments, lived experiences, and intersections you've drawn. That was really fantastic. And thank you, Dr. Kumagai, for giving us kind of that summary of the conversation. So we have a lot of questions coming in, and I think it would be great if we could get to as many as we can fit in. So I'm gonna maybe pose them to one or two of you if one or two of you wanted to respond, and then we can kind of go through the questions and everyone will get kind of a chance to respond. So the first question is, how do we best contribute to making sure that the Ministry of Health and all other sector actors are systemically collecting race-based and other important socio-demographic data? So I think, Ava, you spoke to that a lot. Did you want to say any other comments to that?
Sure. Interestingly, the Ministry of Health in Ontario, we have an anti-racism legislation. It's called the Anti-Racism Act, which came about as a result of advocacy from community groups like our clinic. And as a result of that, government departments in Ontario are supposed to collect race-based data, except for health. Health refused to do it, and they said there's privacy concern. I don't get that. You ask patients all kinds of very private information, but you can't ask them about their race. So, but I think as a result of the pandemic, in fact, now there's an opening to collect race-based data. Even Doug Ford, in one of his press conferences, said that he's now open to collect race-based data. And he said the same thing during a meeting with the Canadian Black Chamber of Commerce. So I think it's time to push that. Again, I go back to my suggestion of talking to your MPPs and use forum like this, because if it only comes from people like me, they kind of know, well, the activists are saying it. But if everybody else is asking the same thing, then I think they will move on it. But it's the federal government also have to collect race-based data as well to make it, I guess, useful for all of us.
Thank you, Avi. I have another question. How do you provide professional and empathetic care when racism is coming from a patient? Does anyone have thoughts on this, Dr. Fung?
Yeah, I think that's actually very challenging because as we certainly see that as healthcare professionals and also as supervisors, and then also as residents and trainees who report back to me about instances where they feel disempowered to be able to respond because as a patient, it's coming from a patient. I think that for supervisors, this is an area where there needs to be some training to know what to do and how to allow this to even become an issue. So when I talk to a lot of trainees, they first feel like supervisors are not even see this as a legitimate issue. They would say, okay, they're just patients, so you just have to suck it up kind of thing, which, as we talked about, it's not the answer to this. So I think that obviously, especially in the mental health field, we have to be sensitive to that people are at different emotional states. They are distressed, and they may say things when they're in certain kind of emotional condition and state. We have to take that into consideration. At the same time, I feel that, number one, that we need to establish the fact that this is not an acceptable act of behavior for anybody, including healthcare providers, to experience, whether you are a staff person or whether you are a trainee. And secondly, there needs to be, as we talk about, a way to approach this where we're not obviously harming the patient, which is the number one rule, but allow a meaningful dialogue. Like, I see that there's anger and exploration, in other words. With the caveat, of course, keeping in mind that we are considering the vulnerable emotional state of the patient, both physically, biologically, and also psychologically and emotionally. But it doesn't mean that we need to shy away and not talk about it, that just because it comes from a patient, we are not allowed to react to it or respond to it in a thoughtful and helpful, constructive manner, to the benefit really of both. Because if you allow this to continue, you are allowing also that some of these ignorant attitudes to go unchecked and uninformed and uneducated. I don't know if Stephen wants to add to that as a trainee perspective.
Yeah, I was going to just comment that I think as trainees, as medical students, and possibly for residents, confronting racism in an appropriate manner that does not affect patient care is absolutely difficult, because, like I said, you are just frozen, right? You don't know how to react, and you have a lot of these emotions going on, but how can you internally process that on the spot, but at the same time deliver care in a compassionate and empathetic way? The thing is, I think there is an opportunity, like in medical education, this is one of my interests, where we can explicitly train learners to respond to these kind of acts of discrimination in a more scripted and more organized manner, because I truly believe that it is not like a skill that you were born with. You have to learn and you have to be trained. And at the same time, there's an importance for preceptors to, like I said, create that environment, because even if you know how to respond, I think trainees possibly fear the repercussions, like, oh, why did you talk to my patient in that kind of way? So I think there has to be some sort of mutual trust and recognition from the preceptors end as well.
Thank you so much, Stephen.
This is Arno.
Sorry, go ahead.
So, Stephen, you bring up an incredibly important point, and a lot of the work that I've done over the years has been looking at how to train faculty to facilitate discussions like that. But it shouldn't be just on the learner to respond, and it needs to be on the faculty, because the faculty have ultimate responsibility in this space. So they cannot ignore it. They can't brush it off. They need to respond. So thank you. I really appreciate your comments on that.
Thanks, Arno. Jeffrey, this question was specifically directed to you. They said, my name is Francis, and I'm a Filipino first-year medical student. I was wondering if you could repeat why Filipinos were thought to be carriers of the Spanish flu, and if you know of any good historical literature to learn more about this. So we can also share some resources afterwards.
Absolutely. So thank you very much, Francis. So in the past, in 1918, when the Philippines was just transferred from Spain to the United States as its new colonizers, what happened was that because probably the healthcare system at that time wasn't so great, and still not is, the problem was that there was lack of resources for the new colonizers. But at the same time, we have to keep in mind that there was probably a lack of compliance as well from the locals. And so they thought that the Spanish flu or the flu pandemic actually lived in it was from Europe, but at the same time, they thought that it mutated with the flu virus that already resided into the bodies of the Filipinos. So this is idea of an autochthonous virus or endemic virus. And so Francis, you can send me an email. So it's my name, jeffrey.andrion@utoronto.ca. And I could send you some articles related to the history of the flu pandemic in the Philippines. Thank you.
Thank you. We had another question. What strategies do you employ to protect your own mental well-being when facing racism and microaggressions? So Avi, did you want to speak to that perhaps?
I was hoping Kenneth could do that, but so maybe I could share. It's like, because my strategy might be different from most people.
Maybe
and
we
even
can hear from both of you.
Yeah, okay. Like even the question is like when the patient says something racist, like I think to me, because I've heard other clinic staff saying that, at the work, when they're working in another little clinic, the client say something racist, and I heard, the ED say, well, there's nothing we can do. The client has mental health issue, and just ignore it. But I don't think we will say that if the client, instead of saying something racist, if they started, I don't know, attack you, like, sort of like, if we think, replace the word racism, they just like what Jeffrey says, if you replace that word with something equally egregious, that is considered as egregious by the society at large, the response would have been very different. So I think it's the same kind of response that we should have. And so whether it's racism or maybe someone like basically someone is abusing you in some way, right? And how do you respond to it? And I think like, I guess it's easier for me to say that because I am the boss at the clinic here. I can, just make a decision that, this behavior cannot be tolerated. The client needs to know that, if they continue to abuse my staff, I can refuse service, right? And I think that, well, of course, it might be not as easy for you to refuse care to a patient, but at some point, people need to know their action has consequences on others' mental health. Because if we allow this kind of stuff to happen, my staff will continue to leave the clinic. Nobody will want to work here. So I think we need to support each other and create an environment for which that people feel supported, so that there's no way we can prevent these things from happening. But when they happen, we respond appropriately and in a supportive manner, then it's easier for us to kind of deal with it. So that's my answer.
I don't know if do we want to go on to the next question, or do you want me to also add to that?
Yeah, if you just had a few comments, kind of, then I can probably get to one more question.
Okay. So from a mental health perspective, I think it's a complex issue. I think that number one is to able to identify your own mix of thoughts and feelings associated with it. I think Stephen really eloquently articulated that, because when these things happens, you second guess yourself, is this really happening? Or you might feel really angry, or you might feel sad, you might feel kind of a loss of your own integrity or loss of an identity that all of a sudden I don't belong here. So a whole host of emotions can go through your mind, and you might be feeling powerless and shocked and not knowing what to do. So identifying your emotions is an important first step. And identifying your own thoughts is also a very important first step. I think that we all have our different ways of coping with our mental health being. So several things. Number one is, I think, not internalizing it as we described. So knowing that a lot of things are thrust upon us, but it's up to us whether we take it in and buy into the narrative. So seeing that there's a narrative there, allowing yourself to be educated about the process of these narratives is an important step, so that we don't take it in and internalize and say, there's something wrong with me. Talking to someone is very helpful. So in terms of coping strategy, talking to a friend, talking to families, talking to people you trust, and then talking to people in power and reporting it and finding mechanisms of turning from a coping mechanism to proactively, as demonstrated by Avi, there's things you can do. So from a coping, the spectrum goes from coping and making yourself feel safer, and making yourself feel safer both emotionally and from a mental health point of view, to moving towards also there's something I can do, a process of empowerment, both in this particular setting or this individual person you need to learn how to deal with, or in a systemic level, you can join a larger cause of movement. So all of this is part of a mental health and well-being response. And I think that getting yourself educated is an important step, because as kind of Stephen is saying, not all of us, in fact, most of us are not born knowing how to respond. And so more opportunities for this dialogue and education is important. And in fact, this whole idea of a minority, identity development, there's lots of theories about how we learn to develop psychologically as a minority. And we can actually learn more. I don't want to get too far afield, but there's a way of learning how psychologically we evolve from feeling like, in a naive way, we're all colorblind, we're all one, to the shock of, no, we're not all one. People don't see me as white. That sometimes for some is a very shocking revelation, even though it's kind of obvious, but it isn't, because psychologically it's sometimes shocking. And so there's a psychological development and growth that we can also learn to move towards. And that helps our resilience in the long term to be able to get the sense of identity and well-being.
Thank you, Dr. Fung. We are just about all out of time, and we have more questions, but as I said, hopefully the conversation can continue long after today. I just wanted to speak to one more question that we received, which was, can we comment on how U of T's student service advisors and workers can better support our students in health-based studies in particular, and also what resource we suggest for U of T students in the Faculty of Medicine, or other healthcare faculties who are seeking supports. And so I can just speak from our office perspective that if learners, staff, or faculty at the Faculty of Medicine are experiencing or witnessing acts of anti-East Asian racism or any form of discrimination, they're able to reach out to the Office of Inclusion and Diversity. You can just send us an email, and sending us an email doesn't create an official report, but rather what will happen at first is you can contact us for support and resources and information to know what other steps might you take, what self-care or other resources might be available to you. And then we can also help connect you to other equity offices. And there's also the U of T's Anti-Racism and Cultural Diversity Office, and they're a fantastic resource to the U of T community in terms of anyone facing racism or xenophobia. And so I will email out after the webinar some of those resources and supports to everyone. And I just wanted to thank again all of our thank you to Dr. ARNO KUMAGAI, who had to step out, but thank you so much. That was fantastic moderation. And thank you to all of our panelists, Kenneth, Jeffrey, Avon. We really appreciate you sharing your perspectives and all of your knowledge with us. So thank you very much for being with us today.